To make a major investigative contribution, it takes knowledge, time, and resources. The Wylie Scholars Program is an amazing resource for emerging vascular surgeon scientists. Receiving this award was so important to me because the Wylie Scholar Program is a premier community for vascular surgeon scientists. Being a member of this scholarly community validates the research that we are doing, and it gives me the confidence to continue to push this research program forward.
The Wylie Scholar Award is a great honor, and Kevin is highly deserving of this award for his exciting and innovative work. Kevin initially came to my lab as a general surgery resident because he was interested in our work on peripheral artery disease. And in particular, he was interested in understanding the genetic differences in patients that led some to develop critical limb-threatening ischemia, while others had only claudication, or pain with exertion. An exciting and important hypothesis that Kevin began to explore at that time was that the differences in patients' outcomes couldn't be explained simply by differences in limb perfusion. He knew from his clinical experience that revascularization is often unsuccessful in the most severely affected patients, so there must be some other explanation for their limb loss.
Dr. Southerland has recognized that chronic limb-threatening ischemia is a different entity from claudication, and that different people respond differently to the same anatomic atherosclerotic pathology. His mouse model is allowing us to develop new ways to understand and treat patients with chronic limb-threatening ischemia, and his clinical interests lie in this area as well, and he is an expert in minimally invasive and open operative therapies for chronic limb-threatening ischemia. He's developing a limb salvage program at our own institution, so he's really marrying his research and clinical interests beautifully.
After he joined the vascular surgery faculty here at Duke, Kevin's continued to build on his previous work, and he's identified important genetically mediated differences in the inflammatory response to limb ischemia that may play a large part in determining whether a patient loses their limb or not. The Wylie Scholar Award presents a great opportunity for him to continue investigating this important observation and ultimately to develop novel therapeutic approaches to prevent limb loss in his patients.
Chronic limb-threatening ischemia is a devastating disease, and it's the leading cause of limb loss in this country. But CLTI is not just a threat to a patient's limb, it's a threat to life itself. The 5-year mortality for CLTI patients is greater than 50%, and that's higher than most cancers. So there is truly a great need for further research to help these patients. The primary therapy for chronic limb-threatening ischemia is revascularization. In fact, perfusion is thought of as the sole determinant of limb outcomes. So our lab has taken a different, innovative approach. We're focused on the non-vascular cell types in the limb. We're particularly interested in cell-cell communication. Our primary focus is how immune cells, particularly macrophages, orchestrate limb survival and recovery in the context of ischemia. Our hope is that this work can increase the understanding of the pathophysiology of chronic limb-threatening ischemia, and that can be a foundation for novel therapeutics that improve limb salvage.
Like so many other Wylie scholars before him, Kevin's poised to become a leader in academic vascular surgery, and I'm truly excited to continue working with him as he works toward his long-term goal of preventing limb loss in severe peripheral artery disease.